You're listening to Greater Good Radio Hawaii. Please visit us online at greatergoodradio.com. Today's guest is Dr. Gary Bell, owner of Spinal Dynamics Hawaii in Mo'ili'ili, and is the owner of Serenity Spa and Salon in the Outrigger Reef Hotel and the Waikiki Plantation Spa in the Outrigger Waikiki on the beach. Besides helping people's health on a daily basis, Dr. Bell also believes in philanthropic giving by providing help to those who are in need.
Who do you consider your advisors? Did you set up a series of people that you depend on, like mentors, when you first started, and they guide you in terms of, let's say, accounting or legal? Or
have to say, number one is, my wife is my consigliere. I usually go.
Answer.
Yeah, I usually go to her for some advice.
Okay.
But another just phenomenal resource, and I like to dip in every once in a while, is that chiropractors have just an incredible relationship with their patients. We spend much more time with them, and sometimes you develop a little bit more, and even professional relationships. Being a chiropractor is I tell you, you're a psychologist. They come in with their problems, just like with a medical doctor. But the difference between with medicine and chiropractors tend to spend much more time with their patients. It's a real, how should I say, hands-on sort of thing. It's a little bit more trust that's developed, but you never, should I say, go out of bounds with that trust. But there are occasions where you can utilize their services; they're utilizing yours. So they're entrusting you. But there are times where, because you've had that relationship with them, you can ask them. If maybe you're treating an attorney, you're not getting free legal advice. I'd never do that. I just tell them, now it's time. You're feeling better as a patient, and it's possible that we might be able to utilize their services as for legal fees. I always go to the professionals. I never try to be my own attorney. I won't go online and say, well, I'm gonna incorporate everything online. You can do it, but there's little tricky things and pitfalls that you'll fall into if you don't incorporate correctly, and you want to have the attorney look at it. So it's well worth the cost if you're looking at long-term business issues. Make sure the incorporation is proper. Make sure that the officers are set up correctly. Make sure you take notes at your meeting. There's a right way and a wrong way. People that do it the wrong way, you look in the Pacific Business News and you'll see 3 pages of bankruptcies and people that are in trouble. So stay out of trouble. Do it the right way the first time.
So who else besides attorneys? I mean, do you have outside accountants, or does your wife take care of that?
Outside accountant. I try not to be my own accountant. I don't want to be my own attorney. I basically let the professionals do what they need to do. Now, a good resource in Hawaii that I did go to was DBET, Department of Business, Economic, Tourism Development.
The Business Action Center they had, or
fantastic Business Action Center.
That one, okay.
They have a library that when we were looking at establishing a resort spa. Again, it's a big investment. You don't, how should I say, you want to have all the cards stacked on your side, or all the chips stacked on your side. And when you are ready to go all in, talk to the experts, talk to the people who have failed even. I talked to several other spa owners. We had consultants that we talked to in the mainland. There's a lot of issues to go through. And, I should say, because we even do consulting now, we've learned so much that people even want to pick my brain and say, what's what.
What type of marketing strategies are you using for the chiropractic business, and are they the same for the spa business? And do they cost a lot of money?
Well, money aside, my whole thing is in developing strategies for our businesses, is that the chiropractic business and business model is completely different than any spa model. Our spa model is more pampering. We don't necessarily have a medi-spa. Medi-spas are a different breed of spa, and they're developing probably a lot faster than any other sector in the spa industry right now. We do understand it. We think that there's phenomenal growth potential with it, but we're in a tourist industry here. We tend to have more.
What do you mean by medi-spa?
Medi-spa is basically medically, I should say, it doesn't necessarily have to be medically run spa, but what they have is they have more medical services. There's Holistica, that's at the Hilton Hawaiian Village here, and what they do is they have a spiral CT scan, and people take corporate retreats, they put them in a spiral CT scan, and they're looking for, how should I say, non-symptomatic problems that people may have. They look at their heart, liver, lungs, kidney. They may take blood. They do a full assessment head to toe. People pay cash for these things because the way the healthcare system works is that you need to have a symptom in order to activate your health insurance to figure out where the symptom came from. This is a little bit more wellness care. But then again, you need extreme resources. Spiral CT scans cost hundreds of thousands of dollars. But then again, the majority of people for Hawaii are looking at more pampering services. But there's aesthetics, there's medical aesthetics. If you look at the TV now, everybody's watching the Swan. They all want to change their appearance. They want to have liposuction. There are some spas that want to incorporate these, I call them high risk. They're actually high risk, high income sort of.
Like plastic surgery?
Plastic surgery. And then again, you have to be willing to take that risk and have that in your business model. So that's really where the Medi-Spa industry is going.
So you market by how then?
Well, marketing, number one, market yourself. Go out, shake hands, kiss babies. For the chiropractic profession, throughout the years, my first and true and I think best way of marketing was, I went out to a lot of the sporting events, and I was basically volunteering time, helping people that might need a little bit of treatment before.
Just set up a table on the side or something?
It also helps their liability. They should either have a sports chiropractor or either a physical therapist or someone that understands injuries, because when you have an event, like say the Tin Man, there's going to be
professional type sporting events.
Professional or even most of these are not professional grade. That's the thing. I'd much rather be treating the more amateurish, because these are the people that actually need our services more. At any given event, I would say if there was an event, a running race, a 10K, there would be at least 20, 25 people that really needed the services, whether they're dehydrated, whether they were getting cramps in their legs, or whether they fell in the race, or something happened. They were running and their back hurt.
Did you charge for that, or
Never.
how does it work? Okay.
No. Good Samaritan law.
You just called them and you volunteered your services, or they
volunteer
called you?
My services, help the walking wounded, which is a good term, because these people will even run when they're injured. But what it is that you're offering a service, and I would just tell them, if you want to, I'm going to help you as much as I can here, put the ice pack on, give them some treatment management information, and just tell them, hey, this is who I am, what I am, and where I am, and if you ever need my services in the future. And inadvertently, just by, having a service, a gratis service, you've sort of bridged the gap between there's a trust issue. All of a sudden, these people think, well, this person's not that bad, and he's giving me some really good professional advice. Let's see what he's like in his regular clinical setting.
Thanks for joining us today on Greater Good Radio. For more information or a transcript of today's show, please visit us online at greatergoodradio.com. This is your host, Evan Leong and Carrie Leong, saying please join us next time for another episode of Greater Good Radio, Hawaii.